and welcome to Spear Medical Education. I'm Eric, and this is another episode in our explaining series. And today we're just going to talk about what tactical medicine is and sort of some of the myths around it and try and debunk those, I suppose. My background is actually military medicine, and then in the civilian world is providing medical support and training to the various police and security services. So it's a subject that I'm familiar with, but it's one that I increasingly find frustrating because it's often misrepresented, or there's people within that community that give it a bad name. So I thought I'd just take the opportunity to talk about what tactical medicine is and what it isn't. So this isn't teaching you to be a tactical medic. I hate to use that word or that phrase, but it's more just showing you what it isn't. And maybe just a little bit about what it is, but it's not aimed to sort of replace any formal training program like TCCC. So, what isn't it? So this is what we see a lot of, cool plate carriers, patches, loads of Velcro patches up the yingers, and completely unnecessary ballistic sunglasses worn whilst filling up your vehicle at the petrol station. So this is unfortunately what it's attracted. People buy the kit and wear it, and automatically that makes them a tactical medic. Unfortunately for them, there's a lot more to it than simply wearing the kit and taking some cool photos for Instagram. So actually, what is it? So first of all, we need to have an awareness. So the awareness of what tactical medicine is, or what makes a tactical medical provider, is this awareness of what your job is. Your job, most of the time, isn't to sit there kicking doors down. Your primary job is to treat patients. And don't get me wrong, depending where you work, part of your job might require you to carry a weapon and engage with the enemy. But actually, at the point that a casualty is taken, your primary role is the preservation of that casualty's life, whether it's your casualty or someone else's. So an awareness of what tactical medicine is and how a tactical medical provider fits into the team that they're working is important. And actually, it's only by having that awareness that we know how to not become a burden, which is this next point. So the awareness comes through training, through education, through exposure to these environments and the teams that you're supporting. Not being a burden. Your job, as I said, is to provide medical support to these guys and girls. And actually, wearing the plate carrier and having the cool patches and the sunglasses isn't good enough. You need to be fit. You need to be fit enough to carry this kit. You have to be fit enough to keep up with the people that you're working with. Otherwise, you're no use to a patient if you can't physically get to them, or if you physically can't extract that patient from that environment. You're absolutely no use to anyone. You might look the part, but unless you can physically carry out the job, then you're no use to anybody, and you'll just become a burden to the people you're with. Next is capability. So understanding your capability. Your job is to be as good of a medical provider as the guys you're supporting are at doing whatever job they are, whether that's kicking in doors, etc. But your job is to be as good of a medic as they are at what they do. And you're only going to maintain that capability through engaging with regular training, exercising, drills, having peers review your practice, engaging with CPD such as this. Just because you're a tactical medical provider doesn't mean that anatomy and physiology all of a sudden can get sort of chinned off, and we don't need to look at that anymore. That's not cool stuff, is it? That's not firearms and plate carriers. No, we need to be looking into it. We need to be staying on top of our anatomy and physiology, our pharmacology, and all the other sort of key stuff that makes us a good medical provider. And then finally, humility. We are there for the patient. We're not there because you get to look cool and you get to wear like awesome patches and work with cool guys. We're there for the patient. We're there to fill that therapeutic vacuum of delivering patient care in a ballistically unsafe environment where care would not normally be delivered, to improve that patient's survival outcome. That is the only reason why we're there. We shouldn't be there because of the way it makes us look or feel. We're there for the patients. Finally, broadly speaking, the other thing that sort of makes tactical medicine is actually understanding the interplay between tactics and medicine. Sometimes good medicine is bad tactics. So what that means is, if you've got a casualty in an actively hostile environment, so whoever the bad guys are still firing at you, and that casualty is out in the open, or that casualty is ineffective. By pulling more hands, more of your team that are utilising their weapons to engage with the enemy back onto that casualty, all of a sudden you've got less weapons engaging the enemy anymore. So rather than having one guy that's not shooting, you've now got 2 or 3 people that aren't shooting, and then all that's going to lead to is bad tactics and more casualties. So actually sometimes we need to know when not to do things, and that's the hardest part with tactical medicine really, is having that awareness of when clinical interventions are or are not appropriate. Which leads us on nicely to what we're going to look at now, which is zoning or phases of care. So the language used does vary depending on your source. So TCCC, for example, over in the States uses slightly different wording, but the spirit of that wording is the same. So I've colour coded it quite nicely, but we start off in the non-permissive environment. So all this means is the enemy is actively engaging you, and actually this isn't the time to start doing your check for danger, full primary survey, sticking needles in, drawing up drugs and all that sort of stuff. This is the point where actually good tactics are going to be what keeps the patient alive. So if you're carrying a weapon as part of this team, then that's where you'd be engaging the enemy with your own weapon. If you're unarmed working with this team, then you shouldn't be trying to pull other people away from their jobs, which is to sort of find, fix and neutralise the enemy, just to treat your casualty with you. Right at that moment, tactics are what's important, not necessarily your experience with the patient that's in front of you. We then move on to the next level of care, which is the semi-permissive environment. And again, TCCC uses slightly different terminology, so I apologise for any Americans that are watching this. But we have our semi-permissive environment. This is where there is still residual threat, but actually the enemy's largely under control. They've either been neutralised and there's a risk of more being present, or actually they've been sort of squirreled down into a fixed position, and we've got sort of tactical superiority over them. During this semi-permissive environment, this is where we start to see your full sort of CABCD assessment happening for the first time. So this is where we can take our time to actually work through a thorough primary survey and start carrying out some of the interventions that we've got, that we can sort of perform. So depending on your skill level, this is when we'd start looking at cannulation, decompressing chests, and administration of drugs and fluids. We've then got our permissive environment, which is exactly what it sounds like. This is just your normal, everyday clinical practice. This is now an environment which there is very little chance of ballistic or blast threat continuing, and we can just do our full primary surveys, secondary surveys, package, extract, etc. So that's just our normal practice. So actually, as you can see, tactical medicine isn't teaching you cool new interventions and using pens as crikes and all that weird stuff that you see on TV. Actually, a big part of it is just having awareness of when good medicine becomes bad tactics, when your good medical skill starts to hinder the actual effort of what's going on around you, and knowing when it is appropriate or not appropriate to carry out sort of clinical interventions and assessment. So, last but not least, just want to remind, just hammer home that reason why we're here, and it's not for yourself, it's for others. We shouldn't be going into this world, you shouldn't be engaging with tactical medicine if all you want to do is wear body armour and take cool photos for Instagram. That's not what it's about. We're here for the patients and nothing else. The kit that we wear, the ballistic vests, the additional training, and the people you're working with, all of that is a privilege, really, that, you know, and it enables us to be able to access patients quicker and improve their outcomes when they've sort of, you know, become casualties as a result of ballistic blast blade sort of trauma. So all that kit, all that training is just there to enable us to get into patients and be able to sort of do this properly. Okay, so there's no leave your ego at the door. We are there for the patients, all right, not for the way it makes us look. So hopefully that's a just a really simple sort of overview of what tactical medicine is and isn't. I hope you found it helpful. If you did find it helpful, give us a like, give us a subscribe, share your thoughts. And if you are interested in being a tactical medical provider, I encourage you to sort of go out there and engage with the formal training and education programs that exist, such as TCCC. Thank you very much for watching. Take care.